Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Samuel here with us today. And Samuel is a tackle with the University of Houston football team, and he's had some lower back pain that's been a result of the cumulative trauma that occurs from playing football at a collegiate level. Now, this is exactly the treatment that J.J. Watt needs right now, following his failed back surgery to diminish the adverse scar tissue and adhesions that form as a result of post-surgical lesions or injuries that occur in the spine. Soft tissue, scar tissue starts gumming up like a cobweb glue substance around the joints, the disc, and even the nerves. And if you get neural scarring, that causes the neural sleeve to get gummed up so the nerve doesn't slide through the sleeve properly, and it pinches the nerve and causes localized pain but also radicular pain. So we're going to go ahead and check Samuel out this morning, and let's have you flex your head forward and backwards for me, Samuel, and then neutral. Yep. Hopefully JJ will be getting in here soon to get this done. This definitely would help him get back into the working out and back on the field quicker. Even though he's had back surgery already, we've got a whole bunch of YouTube videos on failed back surgery patients with hardware and some without hardware. So it doesn't really matter what kind of surgery you've had. And you haven't had surgery yet. That's good. We're going to keep Samuel from having to have surgery. Let's have you on your back right here. Okay. I think JJ's what, 6'7" or 6'8", and
he's 6'5".
290 pounds or something?
290 pounds.
Yep. I've adjusted many offensive and defensive linemen, including defensive ends, that have had herniated disc or back surgery and helped them. There we go. You feel that all the way down?
Yes, sir.
All right. Good. Yep, he's still kicking. I gotta show him you're still kicking. All right. Drop this in my hand now. That's it. Yes, sir. Good job. That's excellent. Okay, now Samuel, let's come over here on you. Tell me, get up sideways, yeah? You know, sometimes collegiate and NFL players need to go outside of the team trainers and physicians to get their care, because we're not just injecting them to hide the pain, we're actually correcting the underlying cause of why they have the pain, which is why I'm adjusting his SI joints first. And then his sacrum right straight in the center here. We're driving it away from L5, so that frees up the L5-S1 nerve. Legs are even now, that's good. So we're going to adjust L5, straight PDA in the Z-axis. And it's important when you're adjusting the spine to adjust it in all three dimensions, the X-axis, the Y-axis, and the Z-axis. There's L3, L2. That's it, man. Well, you're going to feel a ton better today. Yes, sir. You're moving like a champ. That's it. Crack addicts are going to love you. There we go. Okay. He's got a little distortion right here in the cervical thoracic region. There we go. Good. Okay. Now you're gonna feel your head pop up a little bit on this next one. That's it. Put that curve back in your cervical spine. There. And one more. Right there. Good. Okay, let's turn you on your back now, Samuel. Yes, sir. With just your head on the headpiece. Now slide down this way just a little bit. Good. There we go. That's it. Yep. Now, put your arms straight out to the sides for me. See, what I'm doing now is adjusting his AC joints. Now, I'm going to get the table tightened up enough to hold him up. He's a little bigger than our average patient. There we go. His sternoclavicular joint bilaterally, and then now his costosternal joints anteriorly. Good. Okay, you can relax their hands on your tummy. There you go. Now just let your leg go right in my hand here. Oh yeah. Should have felt that in your knee all the way up into your back.
Yes, sir.
Good. Same here. Yep. Good job. Let's sit you up and face toward Joseph there. Oh, he's going to be going to U of H. Yeah, okay. Next year. Okay, here we go. You're a senior this year, right?
Yes, sir.
But you just got a full ticket to go to U of H, right?
Yes, sir.
That's great. Congratulations on that, by the way. Okay. Yeah, that's good. Well, that's a great school, and they're getting better too. They beat OU's first game of the year. That propelled them right up in the ranks.
Yes, sir.
UConn tonight at home.
Yeah.
Okay, let's take a look here in the mirror again. All right. Should have felt easier getting up already. Let's have you flex your head forward and backwards for me now. Yep. Good. See, it's athletes like Samuel who are doing preventative care and maintenance care on their spines that will have a longer career in football because they're taking care of their spines along the way. This will also improve his performance on and off the field. There we go. Okay, now let's have you flex forward and backwards again, Samuel. Take a look from the side there, Joseph. That should be pretty good. Heads up and back more. So, Samuel, how does that feel compared to when you first walked in the door?
It was wonderful.
Great, good. Would you recommend other football players get this done?
Yes, sir.
All right. This is your Houston chiropractor, Dr. Gregory Johnson from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.